Do I feel
All right,
different.
can you say hi?
Hi.
Now, you were on tape just a couple of days ago, prior to surgery.
Uh-huh.
You had a LapBand.
Yes, I did. No longer.
And I contacted the LapBand people. They said that you're not going to be one of their spokesmodels.
That's fine with me.
And you had surgery.
Yes, I did.
And how was the MGB compared to your LapBand surgery? Remember, you get $20 every time you say something good.
Well, honestly, nothing hurt except for, and I don't know if it was the hernia that you found, but my pain is really localized. It's just right here.
Right.
And it's just today's the best day I feel. Good. So you must work it that way.
You don't want to see you back when you feel better.
But no, I mean, I feel really good. It's just I've had this, twinging.
Yeah, like a sticking pain kind of thing.
Yeah, and like
feel like somebody
like,
put two big stitches in there.
Yeah.
Yeah, that's
it. And it kind of rolls, and it's just right in this area. But like any of my staples over here, I just don't even notice.
And how did that compare to the LapBand surgery, pain-wise?
Well, a lot different. With the LapBand, when I woke up, I had this feeling of, oh my God, what did I do? I really did, because I had really bad heartburn.
And how's your heartburn now?
I don't have any.
Pardon me?
I don't have any heartburn at all. Nothing with breathing or.
You can swallow, okay.
Swallowing, yeah, I'm fine. I know with the LapBand, I think it was for about 3 weeks after I got home, and intense Prilosec, it finally went away. But I know it was really intense there for a while after the band, because I had such bad heartburn, to the point where I just had to lay down and really not be able to do anything. It was that bad. So, but not this at all.
And have you been eating?
Trying to.
The yogurt?
Just like little
liquids now?
Yeah.
Are they going down?
Oh yeah. But honestly, I really have to remind myself that I need the energy, to eat.
Because you have less hunger?
I have no hunger.
Pardon me?
I have no hunger. Yeah. And with the band, I always felt I always thought that I felt hungrier after the band.
And we think there's an explanation for that. The LapBand doesn't cut the vagus nerve, it doesn't cut through the stomach, so that the measured hunger hormone ghrelin levels are higher after the LapBand. And the hunger hormone ghrelin or ghrelin are actually lower after the gastric bypass, because we cut through the stomach and cut through the vagus nerve. So we would predict that if you compared hunger after your LapBand, you'd be kind of hungry. And if you ask hunger after the Mini-Gastric bypass, maybe not so much hunger, because we cut through the stomach.
Yeah, I can't believe what I've been surviving on and feeling good. I do feel really hot. I feel really sweaty right now just sitting here.
And do you know what we think that is?
I need the patch, I was told. Maybe one or two.
Right.
Because
I'm just with this weight loss going down, that your estrogen is also going down. And that's a good thing, but sudden drops in estrogen can make you get hot flashes.
Yeah.
You're having a power surge.
Yeah. That's why I had to put my hair up, because I was feeling really, really sweaty.
Yeah.
So, but I feel really good. I feel really good. I don't feel any pain over here, and this is just from...
That's that hernia we found.
Yeah. I just can't... I know you're going to tell me I need the patch now. But I don't, I'm just thinking, thank God you found that hernia. Because of what I've been through. Imagine if you wouldn't have found it. And I had the surgery, and then, just to go through another ordeal. So I'm very thankful that you found the hernia. And I knew something was wrong. I was in constant pain. But no one would help me. I had a doctor tell me that I frustrated him. And that's exactly when I knew I could feel something right over here. I felt it. I couldn't take care of my kids. I couldn't do anything.
What we found is where the port had been for the band, there was a hole about as big as a tennis ball. and some of the intestines and bowel were stuck in it, so it's called a hernia. And so she had been complaining of pain, but because people are a little kind of concerned about the LapBand and the band being placed in Mexico, they had trouble kind of figuring out what was going on. And
Thank you.
so,
Anyway,
Yeah.
I'm just, it's just funny how when people say that things happen for a reason, they really do. And so I'm glad that this part is over me and I can just, look to the future and healthy and positive, and I'm glad that that's fixed because I knew something was wrong.
yeah. Do we take out your staples?
Yeah.
Do you want to do that on TV or turn that off?
It's fine.
You're okay? Okay. So she has a little bit more pain than some of our patients because she has 2 big stitches that we place laparoscopically to close up that tennis ball size hole. And that's going to cause that kind of sticking pain over it. Okay? And hold real still. Well, I think they're going to heal up great. They look good. Hold real still.
You're going to be a new person getting back to normal.
Yeah.
Don't go trying to pick your kids up as soon as you get home either. How long will her hernia, will the stitches and stuff that are there, will those stitches be absorbed, or is that like
She has 2 absorbable stitches in there, yeah. 2 big absorbable stitches.
So how does that, how does that affect, like, if anything was to happen? I mean, do I say, since you're my doctor here and my doctor's over
Right,
there?
that's a good point. Hernias, when they're fixed, have a risk of coming back. And especially because we're going to starve you during the repair process, you have a chance of what we call a recurrence of your hernia. So if you fix a person's hernia, there's always a chance the hernia could come back. So if you get that same pain again, there is a chance that that hernia could recur. And if you get a lot of focal pain there, and especially as you melt down and are thin again, it might find that little lump might show up again. And if it does, that would be a terrible complication where we had failed you. In other words, our goal was to fix that hernia. But we know we're not perfect, and there could be a recurrence of the hernia. If you get a recurrence of the hernia, that would be a bad complication. We feel bad about it, and you might get it fixed. If you have health insurance and they fix the hernia, they could at the same time maybe take out that port and, if there was a plastic surgeon around at the same time, do a little tummy tuck.
Okay, all right. And that is a good question about the port, because my port is still in there, which I hate.
Hate the port.
What is
Hate
the
the
port?
port.
Is that like a...
It's like a
Plastic.
steel washer with a plastic bubble on the top. And that has a hole where you can stick a needle in and pump up the band. And it's sitting in there. It's supposed to stay in band patients for life. And when we started taking out the ports, when we started taking out the bands, we took out the port at the same time. But because people who failed the band have a heavy abdominal wall, we'd have to make a cut about this long to get down to the port. And then we'd have to dig out the port because it's sewn in. And what we found is that your whole surgery took 50-some minutes. You remember?
I think it was 67.
67 minutes.
Yeah.
So that's a LapBand removal and a mini-gastric bypass. 67 minutes. And we found that it takes about another 60 minutes to get the port out. So what we started doing is leaving the port in for a year, and then we have our patients come back after the LapBand, and they melt. And so all of a sudden, taking out the port next year in her will be something like a little numbing medicine and snip it out.
Okay.
But if you want to, so you might be able to talk to, if you have insurance, then you might be able to have a plastic surgeon take the port out, maybe fix the hernia if it has unfortunately come back, and do a little plastic surgery all in the bargain.
Okay.
So it's something to look at.
Okay. All right. Great.